I'd now like to introduce you to Ranu Grewal, who is one of our team members on our patient and family services team. She is a clinical oncology dietitian here at CancerCare Manitoba and will be presenting on eating well during and after treatment. Welcome, Ranu.
Thank you, Cheryl. I'd also like to thank the planning committee for inviting me to present today. Good morning, everyone. So again, today I will be talking about eating well during and after treatment. Again, I'm Ranu Garwal and don't have any disclosures. I have no biases in my presentation today, and I have considered health equity in preparing for this presentation. So today's learning goals are to recognize the benefits of eating and drinking well, list tips for eating well during your cancer journey, especially with a poor appetite, learn strategies to help with weight gain or weight loss. In addition to our learning goals, I will also cover managing treatment side effects, commonly asked questions, and nutrition services at CancerCare Manitoba. To begin, the benefits of eating well is one of the best ways you can keep your body healthy before, during, and after cancer treatment. More specifically, it supports your immune function, it improves your strength and energy, and helps with recovering and healing. It also helps stop that unwanted weight loss or gain, and it also stops muscle breakdown. So on that note, let's begin with the importance of protein. Protein plays a vital role in growing and repairing body tissues. It keeps our immune system healthy. It's the building blocks for our cells. It helps to stop that muscle loss. And during active treatment, the body may require extra protein. So if a high protein diet is needed, it basically means trying to include protein at each meal and snack. So here are some examples of high protein foods. So this slide shows some animal sources of protein, such as dairy foods like cheese, milk, and yogurt. Also, meat, fish, chicken, and eggs have lots of protein. Not only are these foods a source of protein, they also provide vitamin A and D, iron, and calcium. Moving on to plant food sources of protein. Some examples include dried beans, peas and lentils, nuts, nut butters and seeds, tofu, tempeh, and soy. Again, these foods are full of protein, but also provide vitamin E, magnesium, and potassium. Next, I would like to talk about fluids. So drinking fluids is so important at all times, whether it's before, during, or after treatment. It's a means to move nutrients and waste through the body, helps with keeping your blood pressure normal, lubricates and cushions those really important joints and organs, helps to control our body temperature. It also helps with fatigue as well. And of course, it helps to prevent dehydration. So now many of you may be thinking, how much do I need to drink and what is a fluid? Generally, most people need a minimum of 1.5 to 2 liters every day. Fluids include things like, of course, water, but also soup, coffee, tea, milk, smoothies, and oral supplements. Some of my patients will share with me because of treatment or the cancer itself that water tastes awful. So I may recommend using water enhancers like a product called Mio or Dasani drops. Which are available at the grocery store, or even simply infusing water with certain herbs and or fruit can also help. Another thing that patients will share with me is it's just too hard to drink all that fluid at once. And so we suggest sipping fluids slowly and constantly throughout the day to help with hydration. So let's move on to weight changes. I find goals around weight can vary in patients during the different stages in their cancer journey. So, for example, a patient who is overweight may want to prevent or stop that unwanted weight gain during treatment. And then after recovering, may want to lose weight. Or a patient may lose a lot of weight before getting diagnosed and before or during treatment, and then may need to maintain or gain weight moving forward. So I actually want to begin with tips to prevent that unwanted weight gain during treatment or perhaps even after treatment. So have a variety of natural whole foods along with minimally processed foods by doing the following. So number one, including a source of protein at every meal, which I've already covered. Eating more vegetables as they are low in calories, naturally low in fat, fiber filling, and packed full of nutrients. So at breakfast, you can cut vegetables up and add them to omelets. For lunch, add them to homemade hearty soups. Or have a variety of salads for dinner sometimes. Puree them in sauces for those really picky eaters. And don't forget, roast, steam, and stir fry vegetables. The other thing that you may like to try are zucchini noodles or cauliflower rice. Also, add healthy fats to meals or snacks, as these help you feel full longer and so stop you from overeating. Olive oil can be added to homemade salad dressings. Slice an avocado and include it in your salad or as a side with your scrambled eggs. Nuts and seeds are a great snack idea, or you can just add them to your salads. And don't forget to include fatty fish for meals a couple of times per week. For carbohydrates, you want to eat the nutritious sources like whole grains, quinoa, oats, vegetables, and fruit, and really limit or avoid those non nutritious sources like pop, white and brown sugar, honey, candy, fruit juices, and potato chips. Also, you really want to limit fast foods and other highly processed foods. Instead, try to prepare fresh home cooked meals as much as possible. Please remember to watch those portion sizes. So use a smaller dinner plate so you will naturally eat less. Half of the small plate should be covered with vegetables, a quarter with whole grains or starchy vegetables, and a quarter with protein foods. And don't forget to drink an adequate amount of the low calorie fluids like plain or sparkling water and plain tea and coffee. All right, so now let's move on to tips for managing unintentional weight loss. Unintentional weight loss is when a person loses weight without trying to. and is often because of poor appetite or lacking the desire to eat. It does have bad or negative impacts on many things. So, to help, we recommend one, don't wait until you're hungry, just eat. Meaning, nibbling on something small every 2 to 3 hours. The other thing we always say is think of food as medicine. So I will say to my patients, no matter how terrible you're feeling, you still take your medications and attend treatment because it's very important. And so now that's how you need to think about nutrition as well. We also say for foods and fluids, we want to make every bite and sip count. So we may suggest nutrient dense, high protein foods and fluids. One way to do so is by using more or extra healthy fat. For example, switch to full fat versions of milk and milk products, add full fat milk or whipping cream to cereal, cream soups, and smoothies, using extra butter, olive oil, sauce, and gravy to meals or snacks where appropriate, using avocados or peanut butter as a spread, or simply adding it to a smoothie. I can't ask patients to eat more with a poor appetite. So the idea is to take what they can eat and jam pack it with more calories. The other thing that we recommend is prioritizing fluid with nutritional value. In other words, drinking your nutrition. So this can be done by having ready-made liquid nutritional supplements or homemade smoothies, or simply drinking whole milk and consuming or drinking or having, cream soup made with whipping cream. So moving on to treatment side effects. These can vary depending on the types of treatment. So for example, the side effects of targeted therapies are different from the side effects of chemotherapy. And patients will react to treatments in different ways. In terms of nutrition, poorly managed side effects like poor appetite, nausea, vomiting, fatigue, changes in bowel patterns, and taste changes will lead to eating less and losing more weight, compared to well managed side effects, resulting in adequate eating and less weight loss. We can provide you a number of tips to help with these side effects. Now, I would like to share some commonly asked questions around diet. So first one is, can I eat red meat? So what we recommend is having moderate amounts of red meat, which means 3 portions per week, where one portion is 4 to 6 ounces. Of course, red meat is a good source of protein, but it also provides iron, zinc, and vitamin B12. The next question is, can I eat processed meat? So we recommend you either limit or skip processed meat. You may already know examples include ham, bacon, sausage, salami, hot dogs, pepperoni, and some deli meat. Also, any meat that's been cured, smoked, salted, and fermented. Now you're thinking to yourself, well, these are all the foods that taste so good. So tips I provide to patients around processed meat is eating in small amounts and less often, like having ham at a special occasion during the year, or only having hot dogs at a sporting event. Moving on to, is it safe to eat soy, especially if I have cancer? Uh, Soy is a plant estrogen, and is very different than human estrogen in that the plant estrogen is much weaker. Studies show even a breast cancer patient on anti-estrogen medication like tamoxifen or letrozole can have plant estrogen as there are no interactions. So the research actually suggests having 2 servings of plant estrogens safe daily is safe to have, which could include half a cup of soybeans, a third cup of tofu, a cup of soya milk, a tablespoon of flaxseed. What's not recommended is taking soya pills or powders. Another common one is around being vegetarian. There are different types of vegetarians. Some are lacto-ovo vegetarians who will not eat meat, poultry, and fish, but do have milk products and eggs. Pesca vegetarians who will include fish and seafood, but won't eat meat or poultry. Vegans who will not eat any food that comes from an animal. I do understand for some patients, being a vegetarian may be for religious or personal purposes. I do want to share eating animal protein can absolutely be a part of eating a healthy diet for a couple of reasons. Number one, our body absorbs animal protein easier than plant protein. And number two, animal protein is a source of many vitamins and minerals that our body needs. If you choose a vegetarian way of eating, a referral to the dietitian is needed just to make sure you are meeting your protein needs along with your vitamin and mineral needs. And then, of course, the calcium and vitamin D question. As you know, certain cancers and their therapies, treatments, and drugs can speed up bone loss. So it's important for our patients to get an adequate amount of calcium daily, preferably from food sources like milk and milk products. And calcium needs are sort of based on age. And then I would like to touch on vitamin D because it's also important as it works with calcium to protect our bones. And again, the recommended intakes sort of range based on age. And as this vitamin can be hard to get from food, a daily supplement may be needed, especially during those winter months. Another very common question is, does sugar cause or feed cancer? So sugar itself has not been proven to cause cancer. Sugar may trigger our insulin levels. I do want to share cancer growth, or how it takes nutrition from cells, is very complex. And so we don't have all the answers. Insulin may be a factor, but it's not the only factor. Insulin is a potent growth factor for both healthy cells and cancer cells. In general, more insulin means more cell growth. The role of insulin and other growth factors in cancer still needs further research. Our body doesn't need sugar. We eat it because it tastes good. Most people eat too much sugar. So the bottom line, try to limit your sugar intake from the following sources. Sugary drinks like soft drinks, sports drinks, energy drinks, iced tea and juice, foods with added sugars like candy, cakes, cookies, pies, pastries, ice cream, and others. And nutrition services at CancerCare Manitoba. We accept referrals from any member of the healthcare team and from patients as well. Currently, we connect with patients one-on-one, and appointments are in person and virtually. I would really encourage you to contact nutrition services at the number on the screen so that the dietitians can provide you an individualized nutrition care plan. Thank you. Back to you, Cheryl.
Ranu, we just want to thank you so much for sharing your wisdom and your knowledge. And we hope that you have a good rest of the day.